Hi, everybody. Welcome to Act Now. I'm Julianna Forlano. On the show today, Laura Packard, founder of Healthcare Voices, and someone you might know from right here on the act.tv network. She's the host of Care Talk. She's coming on to warn everyone that millions of Americans are soon to lose their health care if we don't extend the subsidies in the American Rescue Plan. Where is the Biden administration on this? Where are the Republicans on this? She will be on the second part of the show to discuss all of that. And first up, we're going to be talking about a new joint effort that ACT-TV is doing with Robert Reich's Inequality Media about deplatforming Fox News. We're trying to get cable companies like Comcast, Charter, and AT&T to take dangerous disinformation that Fox News is spewing off the air. Of course, we're pointing at the vaccine stuff and the anti-vaccine stuff, but there's a lot of dangerous information on the airwaves coming out of there. Is deplatforming them a good idea? I would like to hear your comments as you watch the show. All that and possibly an appearance by our very own Jocelyn McCurdy Keats. You know her also from ACT TV. She is the co-host of Solidarity Live. She is producing for us today, so I'm very excited to have her back there behind the camera and maybe front and center a little bit later in the show. Stay tuned. Thanks for watching. Oh, we're back. Hi, everybody. Okay, Julianna Verlano here. Check it out. We are doing this very cool thing. Hold on. I'm going to show you here. Look, I'm running my own tech. Okay. We are working right now with the fine folks at Inequality Media. That's Robert Reich's group, along with all of these fine people listed here at the bottom. You've got well, these people that you can see that I don't know, Daily Codes. I don't have my glasses on, so I can barely see anything. Who is it? Oh, yeah. Courage California, Progressive Reform Network. There's a lot of good people on here who are trying to get Fox News basically deplatformed. It's a good idea. As you can see, Fox News has been, spreading vaccine misinformation for a really long time. I'm going to go through just some of the videos that are recently what they've been doing in order to spread vaccine misinformation. They were responsible for killing off their own viewership. I mean, the over 60 crowd is watching. It's bad. It's bad. Anyway, we've got a petition drive going and we've got a ton of signatures and we need a ton more to see if we can pressure these companies, cable companies, Comcast, Charter, AT&T, to take this dangerous misinformation, off their airwaves. Do you think that's a good idea? If you do, you can go to, here it is. You can go here to this website. It's an action form. And sign your name on the petition. I will put a link at the bottom of this page in a moment where you can go and actually sign that. But let me just give you some brief information as we move forward. We've got first, I've got a couple of videos that show the kind of misinformation that Fox has been peddling. Here's a nice video. Where should we start? Let's start with this lady. Let's start
forced out of their jobs.
Well, let's not start with her yet. But she's talking about the unvaxxed, and as you'll see, they highlight and bring on I believe it's a police officer who is against getting vaccinated. Talk to him. Let's take a look, and then I'll give you the surprise ending in a moment.
Among those, police officers and firefighters. Now, you can see them here climbing the steps of City Hall today to turn in their boots. Also among the unvaxxed and unemployed are 127 Washington State Patrol employees, including my next guest, Trooper Robert LeMay.
This is my final sign-off after 22 years of serving the citizens of the state of Washington, being asked to leave because I am dirty. State 1034, this is the last time you'll hear me in a state patrol car.
Are
you serious?
Yeah.
Oh wait, are you back? Oh wait, are you back?
Oh, hi. I
Oh, hi.
Hi, everybody. Sorry for that tech difficulty. This is Jocelyn. You all probably know me from this show, and I am very excited to be here if she's ready to speak with me with one of my favorite people, Laura Packard. Laura, hello.
Hello. Looks like there are a few technical issues, but we're working through it.
StreamYard just hates us this week. I really don't know what's going on, but we'll figure it out. I'm happy you're here, actually. I've been thinking about you all morning because I'm almost done with the book you recommended, the T.D. Banks book about healthcare in America. So, well, could you mind talking about that a little bit? Because I actually do think everyone should read it now.
Sure. Well, there's this great book called The Healing of America by T.R. Reid, and he travels around the world and visits various countries and goes through their healthcare systems. And it's really educational to see how healthcare works in other countries. And there isn't any one particular way that's best, but basically every other country has figured it out better than us.
So Laura recommended this on, I think, a couple different moments, and I ordered immediately. I recommend it to anybody who's a healthcare activist or healthcare consumer in America because it's just so rivetingly helpful and also kind of depressing, but which brings us to why you're here today. So I heard a rumor that a lot of people might be about to lose care. Is that true?
Yes. So tomorrow is the anniversary of the American Rescue Plan. It was passed 1 year ago tomorrow, signed into law. And what that the American Rescue Plan did, besides give checks to people and child tax credits and a whole bunch of other stuff, the healthcare pieces in the American Rescue Plan made Affordable Care Act insurance plans more affordable than ever for millions of Americans. But the thing is, it was written to be temporary, and those tax credits expire at the end of this year. So that means that millions of Americans around October could be getting notices in the mail that their health insurance premiums just went way up. And so Congress needs to act. They need to get back and build a better America, I think is the latest version of Build Back Better.
Oh my gosh. Things should be better than they are. How many ways can we say that? That's terrifying.
Well, and what's the additional thing to be concerned about is that as a part of this public health emergency, many people lost their jobs and went on Medicaid for health insurance. One of my family members is on Medicaid now, and they didn't. Medicaid was not allowed to drop people all throughout the public health emergency. But right now, it's set to expire at the end of April. It will probably be renewed at least one more time because the government said they would give 60 days notice before they ended it, and it's fewer than 60 days to April 30th. But when this expires, then every single state will have to look at their Medicaid rolls and go back and do a process called redetermination, which is check back in with people, find out how much money they make and whether they're still eligible for Medicaid. And so what that means is millions of Americans could lose their health insurance this year. And if they make too much money for Medicaid, because maybe they got a new job. And so they will need to re-enroll in a different kind of health insurance. And so part of this is an education problem. letting people know, hey, your health insurance could be about to end. And then part of it is making sure that people can afford a health insurance plan if they can't stay on Medicaid anymore.
That's horrifying. Do you think people realize, because I haven't seen this being talked about, and I mean, it seems like the mainstream media cycle right now is Ukraine, 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 which is obviously incredibly important. I never want to minimize the suffering happening abroad, but I don't think people really know what a precarious situation a lot of us are in. I mean, is your take different on that though?
Well, I think America, we're not so good at long-term thinking sometimes. So we're dealing with the thing that's on fire right in front of us and putting off things that can be delayed. But the problem with that is that a lot of the low-income working class population that could be affected by this are not necessarily easy to reach. It's people that are working 1 or 2 or more shift jobs, and maybe their income level bounces up a little bit and they're not eligible for Medicaid. It goes down a little bit. So they're going into and out of health insurance coverage. And they're also more likely to be moving around. Apartment rates have just gone through the roof. So this is a population of hardworking people that are going to be hard to get a hold of to let them know your health insurance could be going away unless you fill out more forms or sign up for a different plan.
Yeah. Yeah. And I mean, I love that you bring that up, because how, through no fault of their own, these are people with other more pressing concerns than filling out I mean, again, that's a big point of the book, right? In pretty much every other wealthy nation in the world, people are just automatically enrolled in the national healthcare. You're not having to engage in litigious exchanges with brokers and doctors and insurers and all these we have Julianna back, so I'm going to add her. Julianna, hello.
No, hi. I'm sorry about that. I didn't want to come in and interrupt what's very important that you are talking about. And thanks a lot, Laura, for coming on the show. And thanks for Jocelyn. I mean, Act TV, we have such a team, don't we, here on this show right here? So
sorry to everyone for that very thrilling transition.
So jumping in on what you were talking about, what do we need the Biden administration to do? We had a little clip of him speaking at the State of the Union, but as my computer crashed, so went the clip. Laura, can you talk here? Let's bring us all back in. So too bad we can't all equally be. There you go. This is best. This is best. Laura, can you talk to the folks about what we need the Biden administration to do?
Sure. And so at the State of the Union, Biden had several things to say about healthcare, including making the Affordable Care Act tax credits that were part of the American Rescue Plan, making those permanent, also filling the Medicaid gap so that working class people in states like Florida and Georgia and Texas, where their Republican legislators refuse to expand healthcare, doing something about that so that these working class families can get healthcare, lowering the cost of prescription drugs, which is something that everybody will face sooner or later. So Biden shouted out a bunch of different healthcare policies in the speech. And then the hard part is actually executing on them, because a lot of these things have to go through Congress. And with the filibuster in place, that means 60 votes, which for healthcare things we don't have because Republicans are not interested in expanding healthcare. But there is a way around that, and that's the budget reconciliation process, which is the thing that Congress has been trying to do since last year with Build Back Better, and a couple senators in particular stopped it. And
interesting.
Now they're saying they're more open to a deal. So I think we will get something in the next few months, maybe by Memorial Day. But the question is, what's in the bill?
And where are the Republicans on this? And how are they messaging on the fact that they have put a price tag on their voters' lives? How are they messaging around that? Oh, it's going to cost too much, so you could just die?
They are not. Well, or some of them are definitely messaging different things. Like Republican Senator Ron Johnson of Wisconsin said the other day, I think it was a radio interview, he said that if Republicans get control of Congress again, they should repeal the Affordable Care Act. So they are back on that message. And it seems like half of Congress has no interest in tackling healthcare costs, which is something that many Americans deal with every day.
I just, is there, okay, so the Biden administration, have they done anything well in this area? What have they done well? We're still waiting for what you just said, and TikTok, the clock is ticking. And then there's probably things we should basically drop our expectations on from the Biden administration. Can you give us the two camps? What are they doing that we support and that they're doing well? And then what is there like no chance in hell?
Well, we did get Affordable Care Act help last year through American Rescue Plan. It seems likely that we could get that again because they did it before. They marshaled the votes. So drug pricing is something that has been talked about for years and years and years, and Congress hasn't done anything. We got to a deal on that almost a couple months ago. So surprisingly, even with big pharma, opening their wallets and throwing money around like it's Mardi Gras in Washington, it looks like there could actually be a deal on drug prices. That's one of the things that Manchin said specifically that you wanted. But again, it wasn't Manchin that was a problem before. It was Kirsten Sinema on the drug pricing. So we'll see if there's enough pressure to finally do something on drug pricing. But a lot of the other pieces like paid family and medical leave, like the child tax credit, we'll see. With the Congress we have today, it doesn't seem like we have the votes.
Well, and I just want to, before we move forward, I want to do a quick shout out for Laura and all the other healthcare activists that have made any of this possible, because, we, like the people having the kinds of conversations we have, get so lost in the weeds that a lot of this wasn't on the table at all up until very recently. And I just, again, you guys really should watch Laura's Care Talk, which, yes, I'm the producer of, so I realize I am biased, but seriously, healthcare in America is so unnecessarily complex. Like every single episode, I'm like, oh, I didn't know that. I didn't know that. And most of us don't actually understand that much about our health insurance. And we're kind of embarrassed about it because it seems something like, that you should know, right? But it's intentionally intricate because people like big pharma, big hospital, big health insurance absolutely benefit from you not knowing what it's considered it's considered a profit loss when you get the healthcare you pay for, which is wild. Think about that. I mean, if you go into a car dealership and you pay for a car, you walk out with a car. You pay for health insurance, and it's literally their business model to try to make sure you don't get that. So the fact that we're able to have these conversations at all is thanks to your activism, Laura, and everybody should be involved because they're not going to just hand us their $1 trillion profit margins. We have to fight for them.
Absolutely, Jocelyn. Well said.
Absolutely. And your insurance may seem like it works for you until you actually use it. And that's when you realize just how complicated and broken our system is.
There's probably a million stories out there that we could tell. Laura, I know you got into this because of your own story. I have a friend who's flying to California because he needs to have some health care, and his insurance company, he worked in California, and then during the pandemic, he moved across the country to be closer to family, to help take care of some elderly relatives. And he has to go back to California in order to get like his care. It's just absolutely insane. So, and of course, it's not like the insurance company's paying for his plane ride. So it's just, it's insanity producing. And I'm sure there's way more stories than that out there, including people who cannot get care at all.
Laura points out a lot on her show, and I think that you guys should realize is that please don't feel like you can only contest a like 300,000 bill or whatever, something, or 10,000 or whatever egregious thing. Like if you are entitled to something free for your health insurance, like, a women's wellness visit or a dental checkup, and they hit you with a $300 charge, contest it.
People
I mean,
don't contest it because number one, they don't have time. We are deluged with having to, you got to contest this, then the goddamn cable company owes you $13. Oh, look, Netflix is raising their rate by another however much. So it's like they are getting you at every turn, and people are just sunk. So it's like, okay, I just can't, this $80 would actually let me buy groceries this week, but I just don't have time to be on the phone. Also, this is just from my own personal experience. I'd like to hear what you all have to say, or if you have any insider knowledge on this, that companies across the board, including and especially insurance companies, have cut their staff. So they're longer than average wait times that are every single day. I had a friend 2 hours on the phone. She was on hold. And then of course it's a cell phone. So then when the call was lost, it was a real challenge to maintain one's equanimity in the face of said events. I mean, Laura, do you know if they're cutting their staff?
I don't know any facts on that, but I would believe that a combination of work from home and right now unemployment levels are low, and it's hard to get entry level people. And also, if your job,
I don't think so, Laura. I just think they'd rather you be on hold for 2 hours.
If your job is dealing with angry people wanting their healthcare every day, I imagine that the burnout levels are incredibly high, that the call center, levels, that they probably turn over 100% or more a year, that because it's a soul sucking job.
Yeah, for sure. But also I have a feeling they're not really hiring. They love cutting costs. They love cutting corners at the expense of people's mental and physical health. And one bill contestation phase that you have to go through, it will cut your life down by at least 5 years. You know what I mean? It's just like so stressful. I don't know. I think they're counting on people not being able to contest even these smaller bills, and therefore they cut the staff. You have to be on hold. It's a win-win for them.
I mean, if you are working paycheck to paycheck, if you have multiple shift jobs, how do you even have the time to sit on the phone for 2 hours for the call center that's open 8 to 4, 3 days a week or whatever? It is that the people that need help the most are least able to afford the time and difficulty it takes to get through the process.
Let's discuss how a healthcare plan administered by our hopefully democratically elected governorship or government would be different. My assumption is somebody could say, and these hold times are unbelievable. If you elect me, I will cut those hold times. We will hire people, make jobs, etc., etc. They would be accountable to the people.
Well, I think that it's hard to fix our healthcare system because there are so many points and places where it is broken, from the fact that we don't have enough doctors and nurses and medical personnel, to the fact that you have to take 6 figures out of debt to go through school to get there. And so, of course, you're going to be steered towards the high-paying professions to pay off, the $300,000 in medical debt you just have. And then we don't have enough primary care doctors, and the insurance companies aren't paying enough, and the hospital systems are merging with each other and jacking up the rates. And private equity comes in and buys up pieces and tries to suck out even more profits. Like it's such a knot of issues. It's hard to even start unraveling it. The Affordable Care Act was an improvement. Certainly for people like me that are self-employed, or people that worked at small businesses that literally could not get healthcare before because an insurance company would look at your medical history and say no. So that made it better. And the individual pieces of our healthcare system, from the VA to Medicaid to Medicare, some work better than others. And they aren't necessarily even one thing. Like, there are pieces of Medicaid that are privatized, and there's pieces of Medicare that are privatized that insurance companies are trying to make a buck. So unfortunately, I don't think that there is an easy answer that could be implemented tomorrow. But the fact that this is one big, giant knot of problems does not mean that we can't keep picking away at it and unraveling bit by bit and making it better.
Oh, they're doing that thing now where when you go and sign up at the doctor's office, they're like, yes, but the doctor himself is not seeing anyone. So you can see this or that nurse practitioner.
Well, and I think that's something that Laura said that's really important, is that a profit-driven model of care means, think about who has the most money. I mean, in this society, it's celebrities, it's highly, affluent financial workers. And so a lot of the things that are incentivized are essentially luxury forms of medicine. Cosmetic surgery is an incredibly lucrative specialty. The forms of dermatology that are more appearance-based, I have a lot of healthcare workers in my family, and a lot of them obviously got into it because they care about people, right? Why else would you want to heal people?
For the money. They're not in.
Well, and then
No, not your people. I meant the
concierge
plastic surgery people.
practices. Yes, exactly, Laura. Thank you. And it's like, so if you have this model of care where medicine is a business and it's a luxury items are what that system is going to produce, which means things like basic public health interventions, which maybe aren't terribly sexy, but save millions of lives, are not going to get the research and support they need. And that's a thing that, because America has some of the most sophisticated medical institutions in the world, trickles down to the global health sphere. I mean, hero and friend that died a couple weeks ago, Paul Farmer, gave his life to that fight. Like, okay, multi-drug resistant tuberculosis, HIV, all these diseases that are killing and infecting billions of people a year are not getting the resources they need. Meanwhile, erectile dysfunction is everywhere.
It makes cash.
Right. Right.
A question for Laura, back to the idea that there aren't, or the issue that there aren't enough healthcare providers. And it ties in with something Jocelyn said. Are people just not going into the caring professions as they once were because the amount of money that it costs is prohibitive? Or are there other reasons that are, driving down the amount of providers?
Well, I think it's a problem with multiple reasons. I mean, some of it is we've seen how doctors and nurses have been treated during this pandemic, and people are quitting in droves, and understandably so. People are freaking out and berating you because you want them to wear a mask. So some of that is the working conditions, and nurses and medical professionals especially are overworked. They're insufficiently staffed in hospitals and so on. Another thing is the debt. Our broken higher ed system in this country makes it, financially impossible for a lot of people to enter or to do public health type work because they can't pay off their student loans. And another reason is at the top, there are a limited number of residencies for doctors, and the American Medical Association, they control that sort of thing because the scarcity of doctors raises the rates. So there's a little bit of that too.
Oh boy, it's a mess. Wouldn't subsidizing people's educations be something that would adjudicate some of this burden?
Absolutely. So, I mean, we could fix the medical debt problem. We could lift the arbitrary caps on how many people can, go through medical school and have residencies and so on. So, I mean, if we were serious about this, we could increase the number of doctors and medical personnel in this country. But it's going to take fighting and winning against some powerful forces to get there.
And we're too busy on hold with the insurance company to fight those powerful forces.
Well, and I think, our entire relationship with health has to change. And again, Laura, that's something you talk about a lot that I really like. We live in a system where patients are shamed into silence, and doctors have a different kind of shame, which I hope my mom doesn't see this segment. So, so my story is kind of weird. My mom got pregnant in college and went on to be a single mother and a doctor anyway. It's the most impressive story in the world. But at every step, she was hit with patriarchy, with boys club, with ridiculous things you go 6 figures into debt, and then your residency, you don't sleep for 2 years, and lots of hazing. The the journey to become a physician is so complex that it's like, I don't want someone operating on me that hasn't slept in 3 days.
Exactly.
That
Thank
doesn't
you.
make me feel safe at all. Like, and and that, but again, it's a mirror of the capitalist system, really. Like, let's make this very elitist and hierarchical and difficult, when the reality is we actually need a lot of physicians who are well rested and well paid and are not so exorbitantly in debt that they totally understandably feel tempted to abandon more care providing specialties like pediatrics or OB/GYN work for, like, I'm going to do breast implants, and like have time to see my kids. Like, because honestly, as someone who had a front row seat for all of this, like, I would not blame anyone for being like, you know what? This is wild. And then we wonder why things like infant mortality, mother mortality, especially for Black women, are egregiously high in this country. Like, people die, I know I cite this study a lot, but Harvard School of Public Health found that 45,000 people a year die in this country who wouldn't if we had single payer. And that's not even the stuff we're talking about, like physician error or, patient exploitation. It's wild.
What do you make of Biden's, in the State of the Union, he discussed having insulin be $35 a month. What do we think about this? Why isn't it free a month if he's making if he can just make it, cap it at 35?
Well, the plans so far being put forward are that insulin copays would be capped at $35. So what that means is if you have insurance, it would be capped at $35. So that means that the whole pool of people without insurance are left to pay street market prices for insulin, and those are the people that can least afford it. So this is progress, but it doesn't solve the problem.
Wow. That's why I like those. It's like 1 hour and a half State of the Union speech takes 15 hours of breaking down to really understand exactly what the background issues are. So we're very happy that you can come and do this. Jocelyn, were you going to say something?
Yeah, sorry, Julianna. I know it's your show, and I was about to ask Laura.
Go ahead. We're having fun here today, the three of us. It's good. This is the women of Act TV.
Exactly. So Laura, do you have hope for this administration? Because they've been really good and how can people get more involved to, advocate for things like the American Rescue Plans? I don't know, what do you call it? Extension? Like, I don't really fully.
It's not Build Back Better. It's building a better America. Right. So I have hope in that I think that we'll get something. I don't know when it will happen. I think it'll probably be after the April recess, because right now they just finally got a deal on the budget. Next, they're going to deal with the Supreme Court justice. So, I just think that, there's traffic lined up on the road. So I think it's probably going to be after April recess. And, why I think we'll get something is I think that the polling shows that people are angry, and that makes people in Washington, D.C. scared and more likely to do something.
Yeah.
Well, here we are.
But what you can and should do is contact your legislators, your representative, and your senators. Make sure they hear from you that healthcare costs are too high. And if you have specifics you want them to do something about, like lowering the cost of prescription drugs, like making health insurance more affordable, tell them to do something about it. They need to keep hearing from us. And especially if you live in Arizona or West Virginia, get a hold of your senators.
Well, thank you so much, Laura. Thanks for coming on the show. I appreciate it. Laura Packard, founder of Healthcare Voices and host of Care Talk right here on Act TV. I know you have to go, or otherwise we keep you here and continue to have this talking. Wait, let's let her say bye. Are you still there?
Bye.
Thank you so much.
Watch Care Talk at 4:30 p.m. on Mondays.
That's right.
Yes.
Or the repeats are also available. You can watch. Yeah. And Jocelyn, thank you so much for being. See, now I said we were going to surprise the audience with a Jocelyn appearance, and we really surprised.
We did. It was very surprising.
Cut off mid-segment, and anyway, I'll pick up the Fox News thing. That is going to last for the next month, and I'll pick it up again on Tuesday, I think, is our next show,
Okay.
2 p.m. Eastern. Jocelyn, thank you so much. You got to come back on and just be here to chat instead of having to do the back end stuff. And she's gone. You're watching Act TV. Thanks for watching. Don't forget to follow us, etc. If you enjoy occasional technical mess ups, this is the. I'm just kidding. All right. Thanks for watching. I hope you're well. Don't forget to call your elected official and tell them you think that they need to get on the horn about this healthcare thing before millions of Americans lose their health care. Thanks so much for watching. I'm Julianna Forlano. We'll see you next time.